Hey guys, in tonight's news update we want to talk about erectile dysfunction and specifically about erectile dysfunction and diabetes. And the numbers are fairly shocking about the combination of those two. This is Arnold Broad at Healthy at 60 Plus. If you have any questions about this video or any of the videos on my channel, just give me a call or text me at 609-410-4790. If you'd like, you could also leave a question in the comments section below this video and I'll definitely answer it there. So let's see what we have today about erectile dysfunction and diabetes. So there was a small study done, 225 men between the ages of 18 and 65 who had type 2 diabetes. Now we're not talking about type 1, just type 2. Now here's the bottom line of the study. The longer you had diabetes, the greater your risk of ED. Simple study. The longer you have diabetes, the greater your risk of erectile dysfunction. And in fact, the number is around 55 to 60% of men with diabetes have erectile dysfunction. So here are the numbers broken down. Patients with diabetes who had diabetes less than 5 years, 43% had ED, with a little less than 4% having severe ED. Now those with diabetes for 6 to 10 years, 83% had ED and 10% had severe ED. In patients with diabetes greater than 10 years, 78% had ED and 16% had severe ED. So those are pretty shocking numbers, and when you kind of aggregate them together it comes out to be the 55 or 60%. But 10 years is not a real long period of time, and your risk of ED skyrockets. The reason this happens is because the high blood sugar level damages the lining of the blood vessels. The lining of the blood vessels are called the endothelium. Now the lining of the blood vessels produce something called nitric oxide, which helps the blood vessels to expand and contract. It's called vasodilation. When blood vessels become stiffened, there's poor blood flow. That also leads to high blood pressure. But the poor blood flow, the stiffened arteries, produces poor blood flow, and erections work on good blood flow. So the goal is to repair the damage done to the lining of the blood vessels. Now this repair helps your body to naturally produce nitric oxide, which helps to naturally have your arteries and veins expand and contract normally, which dramatically improves blood flow. So how do you do this? Now personally, I'm a big fan of lifestyle changes to help with most medical issues. And most medical issues can be worked with lifestyle changes. And usually that entails changing your diet, exercise, those type of things. However, the amount of nutrients needed for the repair of the lining of the blood vessels, for the repair of the endothelium, is simply beyond the scope of dietary changes. You need really high concentrations of nutrients to make the changes and make the repairs necessary. So that's why I personally use and recommend supplements. Now what I use is something called Proarginine Plus, which delivers something called nitric oxide therapy. Remember I said when the endothelium gets damaged, nitric oxide production falls. So this is nitric oxide therapy to repair the lining of the blood vessels so that your body can naturally produce nitric oxide so that you have the ability to have better blood flow, which helps with high blood pressure, cardiovascular issues, complications of diabetes, and blood sugar problems, and what we're talking about, erectile dysfunction. Now if you'd like to see a really good video on nitric oxide therapy, I'm going to leave a link in the description below this video and also in the comments section below this video, so you can get to that in two different ways. If you have any questions about the nitric oxide therapy video, this video, or any of the videos on my channel, just give me a call or text me at 609-410-4790, or you can leave a question in the comment section below this video. I'll get to it and I definitely will answer it. I want to thank you for stopping by today and watching this video. Have a great day, and here's to your good health.